Okay. Good morning, everybody. Good morning, committee members. Morning to everybody that's joined us this morning. Welcome to House Labor and Health and Social Services Committee. And to those joining us via Zoom, welcome as well. Mr. Caldwell, if you'd please call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Representative McCann. Representative Ottman.
Excused?
Representative Stivar.
Excused?
Representative Wasserberger. Here. Representative Yen.
Here.
Chairman Rodriguez-Williams. Madam Chairman, we have a quorum.
Thank you. Okay, I'm going to go over our rules and procedures for this committee meeting. There is a sheet of paper that has all of them listed if you'd like to look at them yourself outside of the committee room. Please keep your cell phones on silent. Although it may seem an awkward formality, speakers will address their comments and questions to the chairman, not individual committee members or to others in attendance. This helps us avoid personalities and comments of a personal nature. Comments will be directed to the issue under discussion by the committee. Any distracting comments on unrelated side issues or out of order will be called out of order. Speakers will avoid personal criticism, ridicule, or name calling directed at anyone else in attendance at the meeting. This includes comments of a personal nature directed at other speakers, audience members, or members of the committee. For audience members, we expect you will refrain from any behavior that disrupts the orderly conduct of the meeting. Specifically, the rules prohibit speaking out loud when another person is talking, carrying on loud and distracting conversations, any shouting, clapping, booing, wooing in response to a speaker's comments. So we just ask that you simply conduct yourselves in a civil and respectful manner at all times during the meeting. Just for information for everybody, we have lots of people that want to testify on these bills. We have 3 bills on the agenda today. And so again, I will limit public comment to 2 minutes, and in efforts to hear from everybody that wants to testify, I'm going to ask that the committee refrain from questioning those that testify for the sake of time, really, and so that everybody can be heard. With that in mind, we are going to rediscuss House Bill 42. We ran out of time during the last meeting, so we'll begin with that bill, which is titled Regulation of Surgical Abortions, sponsored by Representative Lawley. Representative Lawley did introduce the bill during our last meeting, and we heard from 3 members of the public, and there were no government agencies that came forward to testify. So we will continue with public comment, and I will ask that we'll do the room first, and I'd like to have, if you want to come up and testify, please occupy these chairs. As people complete the chair, please come forward and fill them so we move through. And we have several people online as well for this bill. Okay, so we are on House Bill 42, Regulation of Surgical Abortion, proceeding with public comment. So please come forward if you'd like to testify on this bill. Those in the audience, Either. Regardless if you're for or against the bill. There's 3 chairs, so come on up. Yeah, and my good vice chair will be timing, and I apologize if I have to cut you off when your time is up. So, ma'am, please state your name and whether or not you're for or against the bill, and we'd love to hear your testimony.
Okay, good morning, Madam Chairman and representatives. My name is Susan Lone, and I'm a resident of Laramie County. This bill has caused me much distress, and as a result, I've spent a lot of time in prayer. And I guess I'll have to say I'm here in opposition to House Bill 42, but probably not for the reasons you might think, especially when I testified that I was in favor of House Bill 64. House Bill 64 was a bill submitted to save a life, that of an unborn baby and a mother, and an ultrasound, without doubt, has saved lives. Abortion was forced upon the country with Roe versus Wade. That has since been overturned. So with HB 42, this committee now, some of you new legislators are being asked to concur with abortion. While I understand the intent of the bill is to try to make it more difficult to obtain an abortion, this bill is still sanctifying it. Abortion isn't healthcare. Abortion causes the demise of a living human being. This human being is not just some piece of tissue. House Bill 42 is attempting to take a baby step by attempting to make it more difficult to have an abortion. There are no baby steps in the Word of God. Attempting to abolish abortion by one small step at a time, as is being proposed, is like trying to put a Band-Aid on a bullet wound that's bleeding out. Our country was founded on the 10 Commandments. Our doctors take an oath to do no harm. There is life or there's death. Abortion causes death. By supporting this bill, the act of murder of an unborn is still being enforced, no matter how difficult the bill tries to make it. I don't envy you in your position today on this bill. This is a catch-22. I hope you take all this into consideration. Sin is sin. Abortion is murder. Senate File 96 a few years ago established that a child in the womb was a person. Charges were placed on the perpetrator. How is a woman taking the life of a person any different? Abortion needs to be stopped in the same way by voting against it. This bill is a no-win situation. It doesn't solve the problem. And my hope is that this piece of legislation could be tabled at this time. Your votes and your actions are being recorded today and not just in these chambers. Thank you.
Thank you. Please state your name and whether or not you're for or against the bill. We'd love to hear your testimony.
Candace Machado, Mayor of Evansville, and also a social worker for the last 2 decades in the state of Wyoming. I am against this bill. We are talking about human rights. We are talking about women's rights. And I have sat in rooms with women for the last 2 decades, listening to their stories and the hardships that they have to face when they're making these choices and these decisions. I feel as though this is government overreach, and I feel as though we are at the precipice of creating an environment that, what are we really saying? We're saying that we know better than the person who is going through this situation. And as a mental health professional that has sat in these rooms with these women for 2 years, and a mayor of a town in Wyoming, I am speaking on behalf of the women that I have listened to their stories. I'm speaking on behalf of a social worker. As a social worker, one of our codes of ethics is self-determination. And if we are taking away a person's right to choose what is appropriate for their life, then what are we doing and what are we saying? Self-determination is important. We are putting mental health professionals and providers at risk. I have sat in rooms the last year and have heard legislators, representatives state, how are we supposed to get medical professionals to live in Wyoming, stay in Wyoming? How are we going to get them to want to be here? This bill is not going to help us have medical professionals or mental health professionals want to be here in this state when we are enforcing punishments on them. So I'm absolutely against this as a social worker and as a person who's been fighting for human rights for 2 decades.
Thank you, ma'am. Thanks for your testimony. Please, former Representative Ward. State your name and who you're with and whether or not you oppose or support the bill.
Thank you, Madam Chairwoman. My name is Jeanette Ward, and I'm speaking on behalf of myself, and I support this bill. Every week, I stand in front of that Casper abortuary with a sign that reads, "Wicked judges do not make law." We've been spat at, cursed at, and threatened. At that abortuary, women have been injured. The operators of that macabre establishment refuse to dial 911 because they don't want it to be publicly known. It's very telling that those opposed to this bill who support death don't seem to care about the safety of women. Those who say women's rights, don't really care about women. The Abortion Adverse Events reports show that abortion is 4 times more dangerous than natural labor and birth. Abortions are not safer than Tylenol. The bill does not attack a single business. Other surgical centers have to meet minimum requirements. The abortuary has none. Abortion is not health care, it's death care. Pregnancy is not a disease. Does the baby have a right to choose?
Thank you, ma'am, for your comments. And if anybody else wants to testify, please come forward and fill these chairs. Go ahead. Please state your name and who you're with and whether or not you support or oppose the bill. Thank you, ma'am, for your testimony. Sir, please state your name and whether or not you oppose or support the bill and who you're with.
Good morning, Madam Chairman and committee members. Thank you for this opportunity. My name is Steve Milia from Cheyenne. I stand in support of this bill and hope you would pass it. And I'd like to mirror what Ms. Lone had said earlier, that she opposes it, and I also agree with her in that this is still the taking of a human life. I find it disturbing that we even have to discuss a bill that it should regulate an industry whose primary and sole purpose is the killing of children. Why are we killing our children and grandchildren? They talk about reproductive rights, where we need to talk about reproductive responsibilities. A woman's body is designed and created to create life, and that life needs to be nurtured and whatnot. And I also say that I was in Houston at the City of Houston Health Department. I was trained by Planned Parenthood and similar organizations, so I know what they're talking about. And I oppose their agenda. Also, the supporters of this bill give humanity and personhood to preborn children whose mothers are crossing our borders illegally so that their preborn children can be born here in the U.S. and live. But if a preborn child is already here, a preborn child of American mother that is denied human status, denied personhood, is considered a fetus, which is actually Latin for baby, is an inanimate object that is loathed, dehumanized, and a thing that be killed and discarded. All the while, this industry, whose primary purpose is to kill children, does not want any regulation. that would enhance any safety features to at least ensure the mothers won't die as well. The abortion industry, whose primary and sole purpose is to kill children, touts a false safety record and states that additional regulation to bring it up to par with other surgical centers is just too expensive. Is it too expensive, or are they just disingenuous to help ensure the absolute safety of women they purport to serve? It is a well-known fact, and also stated by former Representative
Mr.
Ward.
Elliott, you're out of time.
Out of
I
time.
apologize.
Oh, no problem.
Yeah.
Thank you.
Thank you for your testimony. Sir, please state your name and who you're with, whether or not you oppose or support the bill.
Madam Chairman, excuse me. Bill Winnie from Sublette County, speaking for myself. I support the bill. I'd like to offer you a slightly different perspective than you've heard here. The Navy has long-standing had a policy that a pregnant woman cannot go to sea, or even if they go out on a ship that's simply moving berths from one berth to another in a harbor. And the issue is simply that complications occur. I sat down on one of my ships. I had a medical department and had a complement of about 350 women out of a total of about 1,300 to 1,400 total crew. And so we paid attention to that rule. And I asked the head doctor, I said, okay, what's the issue? And his response to me very simply was, well, there are complications, admittedly quite rare, but they can take the life of a woman in minutes to an hour, and they cannot be separated from appropriate medical care by being at sea on a ship or somewhere where they can't get off. And so I offer you that as a thought as you seek to regulate the facilities that provide these kind of services. Subject to your questions, thank you.
Thank you, Mr. Winnie, for your testimony. Okay, Mr. Caldwell, we have several folks on Zoom, and let's see. If anybody has their hand raised in opposition of the bill? Okay, thank you. Ms. Shaver, welcome to Labor and Health. Please state your name, who you're with, and whether or not you support or oppose the bill. And folks on Zoom, let's try and keep the testimony tight on the topic of the bill, which is regulation. And you have 2 minutes to testify. Please, ma'am.
Chair, for this opportunity to testify on this bill. I'm Marcy Shaver, a resident of Torrington, was born and raised in Wyoming. I'm speaking for myself and other people in my community that stand firmly against this bill. I stand against it for the following reasons. It is a trap law designed specifically for the closure of one certain business in the state by ordering unneeded regulations. Other more dangerous procedures are performed without such requirements in doctors' offices. 2, the medical profession has clearly defined words which the legislature cannot arbitrarily change. The bill seems to have been written by folks with shaky knowledge of both the female reproductive process and medical knowledge. We've heard from medical professionals about the safety of abortion at every stage. Turns out that doctors know more about the subject than do legislatures. The complication rates are minuscule. 3, the only surgical abortion is a C-section. It surgically ends a pregnancy. 4, had such a law been in place during my childbearing years, my life would have been put at risk more than once. And 5, women do not owe the production of new citizens to any state or nation, no matter what the religious beliefs are of their legislators. Thank you.
Thank you, Ms. Shaver. Mr. Caldwell, if you could bring in some. Thank you. Dr. Bartholomew, welcome to Labor and Health. Please state your name, who you're with, and whether or not you support or oppose the bill. And you'll have 2 minutes.
Good morning, Madam Chair. and committee. Dean Bartholomew, family physician in Powell, Wyoming. I'm standing in favor of this bill. Several points I want to try to clarify. We've had a lot of facts stated. One is that abortion is safer than labor and delivery, which is true, but really is an invalid argument. We're comparing apples to oranges, and I'd be happy to unpack that if I have time at the end of my 2 minutes. We also have heard about stats of the safety of first trimester surgical abortions, which again is very true. First trimester abortions are very safe. But I would like to speak to second trimester abortions. We've not really heard about those much in these proceedings. Currently, I believe, if I'm correct, state law still allows for surgical abortions up to 23 weeks of pregnancy, and that, if you were to measure out the size of that fetus, we're talking about a fetus at that point, would fit in the palm of your hand. If you took into consideration the amniotic fluid and the sac and the placenta, you're talking about a fist or 2 fist size amount of tissue. And so I just racked my brain trying to think of general surgeons and orthopedic surgeons and gynecologic surgeons that perform procedures in their offices where they would remove that amount of tissue within inside of an organ or inside of the intra-abdominal space. And I just can't think of other procedures where we do that. When we do procedures in an office and not in a surgical setting, we're usually doing them on the outside where we have control of bleeding, not removing that amount of tissue at one time without having all of the other things that come with a surgical suite. And so, in fact, Madam Chairman, I think what I would ask of, and I think I've seen that there's several of my OBGYN colleagues in the audience there, is to think through this a little bit when we talk about similar procedures, and that would be a D&C for a miscarriage. And so if we've had a pregnancy that has, the fetus has died and has not passed, and then that mother is taken for a D&C. And I believe, to my knowledge, it's been 15 years since I've worked in the hospital, but to my knowledge, most, if not all, D&Cs are performed in a surgical setting, in an OR, in a hospital. And I would ask of my OBGYN colleagues there to explain to the committee why that is. And I don't want to speak for them, and I would ask them to do that. I believe it's again, I'm happy to stand corrected, but I believe it's because we need access to the proper surgical equipment, to anesthesia, and for measures of resuscitation. And so if we think it's safe for the mother in a situation of a D&C to have an operating room, I sure think our mothers in second trimester abortions should have the same afforded to them.
Thank you, Dr. Bartholomew. Ms. Morgan, welcome to Labor and Health. Please state your name, who you're with, whether or not you oppose or support the bill, and we'll hear your testimony for 2 minutes.
Yeah, my name is Connie Morgan. I'm from Casper, Wyoming. I'm not with anybody. I'm just with myself. I wanted to get on here and say I oppose this bill. I had a medically necessary abortion probably about 23 years ago when I lived in the state of Washington. My fetus was diagnosed with limb-body wall complex, and it was a very traumatic time. An abortion wasn't what I was wanting to have, but my fetus wasn't viable outside of the womb. And had I tried to have my baby, it could have possibly killed me during childbirth, I was told by the doctors that I was seeing at the time at Swedish Medical Center in Seattle. I just want to say that having an option to have medically necessary abortion was really important to me. They had related a story to me about a woman who was from Mexico, and she had had no prenatal care at the time, and she gave birth to this fetus and it killed her in childbirth. And when they related that story to me, I definitely knew that I wanted to have this abortion. I had an abortion in a hospital, in an operating room, and I was very well taken care of. I was 4 months along in my pregnancy, and my milk came in. All the things happened to my body that would happen when you actually give birth to a child. And I'm really glad that I had access to that. And I think it's very important for women to be able to have access to these kinds of procedures to save their lives. Thank you.
Thank you for your testimony.
Good morning, Madam Chair.
Good morning, Mr. Brechtel. Please state your name and who you're with, whether or not you support or oppose the bill, and we will hear your testimony for 2 minutes.
Bob Brechtel, Natrona County citizen, former legislator. I rise in support of HB 42. To tack on to what the previous doctor had talked about, the lateness and the term of pregnancy, one point of interest was from the National Healthcare Library, May 2020. They say that in Finland, where epidemiologic record linkage has been validated, the risk of death from legal induced abortion is reported to be almost 4 times greater than the risk of death from childbirth. According to a Texas group who is focused on this very issue and trying to sort out their problems down there, as was brought up earlier this week, what they point out is that there's a federal maternal mortality tracking system that has been a roadblock for them. I'd like to point out also that Wellspring is not far from Casper TrueCare. It's only 1 block, and most trusted organization that offers free ultrasound, professional counseling, and the love. And they turn no one away. Thank you, Madam Chairman, for the opportunity to testify.
Thank you, former Representative Brechtel. Okay, and then we'll take one more after that and call it. Thank you, Mr. Caldwell.
Good morning, everybody. Thank you so much for having me here. Can you hear me okay, Madam Chairman?
Ms. Forsyth, yes, we can hear you. Welcome to Labor and Health. Please state your name, who you're with, whether or not you oppose or support the bill, and we'll hear your testimony for 2 minutes.
Absolutely. Thank you so much, Madam Chairman. I'm Janine Forsyth. I'm Zooming to you from Laramie, Wyoming. I am a 20-year resident of Wyoming. I'm a mother of 2 beautiful kids, one that's at a ski meet right now, so I'm hoping he's doing great. And I'm also the executive director of Pro-Choice Wyoming. We are an organization that has hundreds of members scattered all throughout the state. We have folks in every single county. 2 minutes is not enough time to counter most of the misinformation that's been shared this morning, but what I want to say is that HB 42 puts women's health at risk. And more importantly for me personally is that we're wasting our taxpayer dollars. This bill is not an original Wyoming bill. It copies failed legislation from Texas and Idaho that's already facing constitutional challenges over privacy rights and healthcare access. Similar laws have been struck down repeatedly, costing states millions in legal fees. Wyoming's limited resources should fund essential services, not defend flawed legislation. The real-world impacts of bills like this are devastating. After Texas passed similar restrictions, over half its clinics closed. Women, especially in rural areas, had to travel hundreds of miles for care, often delaying treatment and facing increased medical risks. Some couldn't afford the travel, the time off work, or childcare. Others sought dangerous alternatives. The bill's vague language around medical emergencies forces doctors to choose between providing necessary care and risking 14 years in prison. This deters qualified providers from offering essential healthcare services, creating a dangerous gap in women's healthcare. Despite claims of protecting safety, abortion has a lower complication rate than common procedures like colonoscopies. The admitting privileges requirement is purely political. Hospitals often deny these privileges regardless of a provider's qualifications. Leading medical organizations, including the American College of Obstetricians and Gynecologists, oppose these restrictions because they harm patient care without improving safety. I urge you to vote no on HB 42. Let's protect women's health and use taxpayer money responsibly, not waste it defending unconstitutional litigation. Thank you so much. Appreciate you.
Thank you, ma'am, for your testimony. And we'll take one more. Okay.
Good morning, Madam Chairman and committee. My
Good morning.
name is Person. I am president of Wyoming Right to Life. We support House Bill 42. The definition of surgery is that it's a procedure that uses manual and instrumental techniques to remove unwanted tissues or foreign bodies. This is surgery. Every abortion that uses a cervical dilator, a vacuum, a curettage, or a Sofer forceps is by definition surgery. Any procedure that requires an accounting or an analysis of the body parts or tissues removed by instruments is surgical. Wyoming women deserve the assurance that the facilities they visit for abortions are of the highest medical and surgical standards. It is for the safety of Wyoming women that you must pass this bill. Of all the ambulatory surgical facilities in Wyoming, why are abortion clinics exempt from this common sense status? Likewise, we support the requirement that all physicians in Wyoming performing abortions, whether surgical or chemical, be fully licensed in the state and have admitting privileges at a local hospital. In the event of complications resulting from an abortion, this assures a speedy continuity of care of the women who have suffered abortion traumas. A real-life horror story of abortuaries that are left unregulated and uninspected is the story of Dr. Kermit Gosnell in Philadelphia. It is too gruesome to relate here, but I urge you to watch the documentary about how this abortion clinic went uninspected for 15 years. Dr. Gosnell is currently serving life without parole for murder. To stop
Ms. Halverson, you are out of time. I apologize.
support
Thank you
the
for
bill,
joining us.
so die.
Thank you. Okay, Mr. Caldwell, we will close public comment at this time on House Bill 42. And committee, what is your pleasure on House Bill 42? The bill's been moved by Representative Guggemos, second by Representative Klauston. Oh, I apologize. The bill was moved by Representative McCann seconded by Representative Clouston. Okay. So discussion on House Bill 42 committee or amendments. Representative Yin.
Madam Chairman, the only discussion on this bill I'm going to say is that I think we all know that this is a bill that only targets one institution in the entire state, which is unfortunate that we're passing bills that only target one exact place. I don't like doing that.
Representative Wasserberger. Yeah, and committee, I'll just clarify, we do have a proposed amendment that was brought to us from OSO. It has my name on it as chair because there was a typo. So the current bill reads that the fine is $1 million instead of $1,000. So we will at some point, if the committee chooses to move that amendment as well. So any further discussion on Representative Wasserberger's comment or on the bill or amendments? Representative Clouston.
Thank you, Madam Chair. You know, I do see these facilities as a surgery being performed, I think as the doctor stated. I do think all surgery centers should be inspected for safety. I think that's just a reasonable and way to help protect Wyoming and the people that are having these services.
Okay, committee, any amendments on the bill or further discussion? Representative Wasserberger. Yes, please do. This would be the time, Representative Wasserberger.
It's a question for where that amendment is. There are two different fines. There's one on page 6, and then there's one on page 8.
I'm looking at the one on Madam Chair.
Representative Wasserberger, yeah, and committee, when you do move an amendment, if you can just, as Representative Yen said, just state the page and what line you're thinking of inserting it. If we need to have further discussion on it, we can do that. So go ahead, Representative Wasserberger. The amendment's been seconded by Representative Yen. Discussion on the amendment.
Madam Chair?
Representative Clouston.
If it's a friendly amendment, I think we should, page 6, line 23, also talks about $1,000. I just feel like we should probably keep it consistent in both places.
Okay, to the amendment sponsor, Representative Wasserberger.
Amendment.
Okay, any discussion on page 6, page 8, reducing the fine to $750? Or changing the fine to $750. Further discussion on the amendment? Seeing none, all those in favor of Representative Wasserberger's amendment on page 6 and page 8 to reduce both fines to $750, please say aye.
Aye.
All opposed?
No.
Okay, committee, we're gonna have to speak up and be a little louder here. I'm gonna ask for a show of hands on the amendment, Representative Wasserberger's amendment. Raise your hand if you are in favor of the amendment. Okay, 3 in favor, all opposed. 5 opposed. The amendment has failed. Further amendments from the committee. Okay, I will move the proposed amendment that you all got the handout for from LSO, which is on page 8, line 1, delete the $1 million and insert $1,000. Just kind of a Scrivener's error there. Okay, it's been seconded by Representative Guggemos. Discussion on the proposed amendment. Okay, seeing none, all those, please raise your hand. All those in favor of the proposed Representative Rodriguez-Williams amendment to correct from 1 million to 1,000 on page 8. Okay, the amendment has passed. Any further amendments? Any further discussion on House Bill 42? Okay, seeing none, Mr. Caldwell, please call the roll.
This is a roll call vote for House Bill 42 as amended. Representative Clouston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann. Representative McCann. Representative Ottman.
Aye.
Representative Stivar.
Excused.
Representative Wasserberger.
Aye.
Representative Yen.
No.
Chairman Rodriguez-Williams.
Aye.
Madam Chairman, that is 7 aye, 1 no.
Okay, House Bill 42 has passed Labor and Health. Representative Lally, you'll carry that bill on the floor. Thank you. Okay, we will move on, committee, to our next bill, which is House Bill 159, protecting water from chemical abortion waste. The bill sponsor is Representative Baer. Welcome, Representative Baer, to Labor and Health.
Thank you, Madam Chairman.
If you would do us the honor and please walk us through your bill.
Thank you, Madam Chairman, and I'll try to expedite this as best I can so we can respect the committee's time, but I do appreciate this esteemed committee's opportunity to hear this bill and appreciate your attention to it. This bill, which I'll present in just a moment, does not prohibit abortion. It is focused on protecting the life and health of the mother as well as the public. It is not designed to help protect the life of the unborn child, which unfortunately will never be able to make snow angels in the snow or go to a prom or own a business and have a family. But it does protect the safety of the women who go through an abortion, as well as the public. According to the FDA, as of June 22, there are 28 reported deaths in mothers associated with mifepristone. Sorry, I'm going to work on that some more. None of those, which is one of the abortion drugs. There have been 4,000 reports of adverse effects for mothers experiencing hemorrhaging and life-threatening infections. The abortion pill has caused over 1,000 reported hospitalizations, including death. And there's likely more information we're unaware of. In 2016, the FDA stopped requiring that adverse effects be reported, so only deaths are reported today. Chemical abortion pills are responsible for over half of the abortions taking place in America, and most certainly in Wyoming. Where they are recorded overseas, it's over 90%. So more than likely, 90+% of abortions are chemical abortions. So clearly, mothers need more medical oversight to keep them safe. That's what this bill does. Chemical abortions don't only pose a risk to mothers, the endocrine disrupting chemicals also pose a risk to the general public. Abortion pills contain endocrine disrupting chemicals and are being sent into our public water systems. Pharmaceuticals pass through the sewage treatment plants and landfill sites. Those products are used to irrigate or fertilize agricultural land. The effects of pharmaceuticals in our waters can become magnified higher in food chain, and predatory animals accumulating greater levels of the drugs than found in their local environment. These contaminants in water can pose risks to reproductive health by impairing the development and fertility of animals and human life. The weight of the data has shown that humans and animals have suffered serious health consequences from the exposure to environmental chemicals that interact with the endocrine system. Even small exposure to endocrine disrupting chemicals can cause massive issues during highly sensitive stages of human life cycle, including pregnancy and lactation. I'll walk through the bill. On page 2 through 5, we have several definitions of terms that are in the bill, and they do appear in other places in the green books, but you can see those definitions on pages 2 through 5. Beginning at the bottom of page 5, the bill requires healthcare providers to physically examine the mother before prescribing chemical abortion drugs. On page 6, the doctor is required to be physically present with the mother when she ingests the first abortion pill. The doctor must also schedule a follow-up visit to ensure the well-being of the mother within 7 days. This is prudent and reasonable. Often chemical abortion drugs kill the baby but do not successfully expel the dead baby, creating serious health risks to the mother. On line 11 here on page 6, the doctor is also required to provide the mother with a medical waste bag and a catch kit for the mother to use to prevent the baby or the endocrine disrupting product and byproducts from entering the public water system. And on line 17, there's a felony punishment for doctors who fail to do the things I just described. Beginning on line 22 of page 6, the bill lists out exceptions to these requirements, which do not apply. These regulations and punishment do not apply to the mother herself or any attempts to treat an ectopic pregnancy. So the doctors are exempt from doing anything that they can to save the life of the mother. On line 19, the bill provides that where the provisions conflict with the Life as a Human Right Act, the Life of the Human Right Act shall control. This language is there to ensure that when the courts uphold the Life as a the Human Right Act, will control again once that court decision is completed. On page 8, the bill specifies that no abortion drug shall enter the water system in Wyoming, and placing all liability with the drug manufacturers to ensure compliance with the act. Moving on to page 9, a 6-year statute of limitations is created, allowing any person to bring a lawsuit against an abortion drug manufacturer if they discover evidence of the abortion drug in the water supply. At the end of page 9, the bill specifies that it is not a defense for an abortion drug manufacturer to claim ignorance of the law or to rely on other courts or federal rules to subject to challenge at the time of the discovery and a few other scenarios. Moving on to page 11, and at the bottom of page 11 going on to page 12, jurisdiction of the courts of Wyoming is discussed, and we're allowing our courts to take cases under this act. At the end of page 12, the bill provides affirmative defenses to the defendant, so this is not a one-sided bill, it protects the defendant as well. If they get sued under this act, they have to prove by a preponderance of the evidence, which means more likely than not, that the imposition of the civil liability will violate a constitutional right belonging to the defendant or a third party represented by the defendant personally. Moving on to page 13, line 17, the bill provides sovereign immunity for the state and its political subdivisions and its employees for claims brought under this act. including constitutional challenges to it. We can skip on to page 18. On page 18 and starting on line 19, there begins a severability clause, which provides that if any provision of this act is found to be invalid, it is severable from the rest of the law. And then on page 20, the bill further discusses the intent of the legislature as it pertains to the severability clause. And if you can move to page 22, the bill provides authority for the Department of Health to promulgate rules to enforce the act. On page 23, it contains minimum standards for those rules, including mitigation and remediation efforts to address the environmental effects of the abortion drugs and for testing the water systems for the endocrine disrupting chemicals. On the last page, page 24, you can see that the bill, if enacted, would take effect immediately. And Madam Chair, I will stand for any questions.
Thank you, Representative Bear. And it appears that this bill has a fiscal note attached or administrative impact.
Yes, Madam Chairman, that has to do with the testing requirements that would be enacted with the bill.
Thank you. Committee, any questions for the bill sponsor on the bill? Representative McCann.
Thank you, Madam Chair. Representative Bear. Are you aware of, and if you are, can you name any studies that actually show that this has been happening as far as actually getting in the water supply and or in agricultural, please?
Representative Bear.
Madam Chair, thank you. Representative McCann, I really appreciate the question because I do have a study. The study was just completed at the end of 2024. They're still working on publishing this study, but I did get an advanced study copy of it. And what has been determined by testing at 3 different cities. One was in the southwest part of the country, one in the mid-Atlantic states, and then one here in the Midwest. And what was found was that there is these endocrine disrupting chemicals in our water supply. Now remember that initially this would be in higher concentrations in sewer water or sewage, but the testing was done on the actual potable water supply. And what was found in the city that was in the southwest, it was quite high at 11.6 parts per trillion. And then in city C, which was here in the Midwest, was 2.6 parts per trillion. So it can vary, but what that 2.6, well, actually, we'll just take the one in the Mid-Atlantic where it was just under 1 at one point where it was tested part per trillion. I'll just kind of give you a scenario of what that would mean. So a 154-pound person drinking 3 liters of water a day for a period of about 280 days would have ingested enough chemical to have an abortion. So what that tells you is that all of us are probably having these chemicals in our system, and the more water we drink or the lighter we are, the more effective it is than that. So a 100-pound woman would have this happen in a much shorter period of time. I say that all to tell you that it's not just women, it's men, it's our animals are getting this water into their system. And it doesn't just stop pregnancy. This affects, the amount of estrogen that women can have, and men need that chemical as well. Progesterone actually is the one that is stopped by this chemical. And so it has an effect on women that they have menopausal type reactions to this water. And so it is a concern. And this bill would address that concern.
Follow-up, Representative McCann.
Madam Chair, who funded that study?
Representative Bear.
I may need some glasses. Madam Chairman,
Representative Bear.
thank you. Through the chair, Mr. Representative McCann, Pew Research. Leave it at that.
Additional questions from the committee. Representative Klauston.
Thank you, Madam Chair. Thank you, Chairman Bear, for being here, and you know my stance on pro-life. I do have some questions on this, though. You know, we have 2 drug manufacturers in the U.S. that make these drugs, but there's several worldwide. How would we know which manufacturer that these drugs came from?
Representative Bear.
Madam Chairman, thank you, and excellent question, Representative Klauston. So if you go to the penalty page, actually, it's going to be at the top of page 9. Starts at the end of page 8. If a plaintiff who brings a suit under this section is unable to identify the specific manufacturer of the abortion drug found in the wastewater, public wastewater, or public water supply, community water system, or waters of the state, then the liability shall be apportioned among all manufacturers.
Follow-up, Representative Klauston.
Thank you, Madam Chair. Thank you, Chairman Bear. So do we have jurisdiction? You know, a lot of these drugs are made in China and Bangladesh and India. Do we have any way of, you know, suing, fining, punishing those companies from out of country?
Representative Bear.
Madam Chairman, Representative Klauston, we do sue them on many things. Whether or not the courts can affect, you know, the punishment is the question. And that has to do with the federal relationship with those countries. So that would come down to what was the outcome of that lawsuit and what is the relationship between our governments.
Representative Yin.
Madam Chairman, thank you. Representative Bear, so it's curious that this really only, you were talking about endocrine disruptors, but this only applies to abortion drugs. Birth control could be an endocrine disruptor. Bisphenol A could be an endocrine disruptor. That's found in 99 parts per trillion in North America. Should we ban all of those?
Representative Bear.
Madam Chair, Representative Yen, great question. And this bill specifically excludes those drugs. So it is specific to abortion drugs. But I think further study needs to be done. If those are at a level in our systems that they're going to create issues, then yeah, I think that we should look at that.
So Madam Chairman.
Follow-up, Representative Yin.
Yeah, thank you. Like I said, bisphenol A is found in our drinking water, so not just the sewage. It's in our drinking water at 99 parts per trillion. That's more than what you've quoted in that research study that hasn't been peer reviewed yet. I mean, I would love to hear of your opinion on why you focus so solely on abortion drugs.
Representative Bear.
Madam Chair, Representative Yin, I think my statement at the beginning made it pretty clear, you know, where I stand on that particular issue. But the fact that we've not, as a country or a state, taken this into account and considered the health of both the mother, which this bill addresses at the beginning, or the public health, which it addresses through the water system, I think is something that we need to start moving on. And this bill does start that action.
Committee, any additional questions? Representative Wasserberger.
Thank you, Madam Chair. Representative Bear, I was just wondering, so if we're, you know, doing the proper disposal, what would be the way of doing the proper disposal with this bill?
Representative Bear.
Madam Chair, Representative Wasserberger, so at the beginning of the bill, it talks about the kit that the doctor would provide to the woman, and then it would have a biohazard bag with it. It would, the Results of that abortion would be put into that bag, and then they would be returned to the doctor's office for disposal.
Additional questions? Okay, I have one. Representative Bear, I was recently participating in an online survey that my county put out in regards to planning and zoning. And I came across an alert, one of 4 alerts on the website, and it states that the improper treatment of human waste can be deadly. Don't put yourself, your family, and neighbors at risk by not following the rules. I'm just curious if you've heard any support from local municipalities or counties in regards to planning and zoning on the bill.
Madam Chairman, I have, and so there is a groundswell of concern about what we put into our water systems. And, we're constantly under pressure as a state and our local communities to fund proper wastewater management. And so I think it's important that we begin to test and determine what kind of things are ending up in our water supply so that we can protect the health of our citizens.
Thank you. Any additional questions regarding the bill? Okay, seeing none, thank you, Representative Bear, for presenting the bill. We will move on to public comment on the bill. Do we have any government agencies that would like to come forward, please? Welcome. Please state your name, who you're with, and your take on the bill.
Thank you, Madam Chair and members of the committee. My name is Jennifer Zignett. I am the Water Quality Administrator for the Wyoming Department of Environmental Quality. And what I'd like to cover today is some thoughts on the bill as they pertain to the proposed amendments to the Wyoming Environmental Quality Act, specifically Article 3, which is the Water Quality Division statute. So if I may, Madam Chair, proceed. Thank you. So to reiterate, I know Representative Bear walked through the bill, but just to focus in on the changes to the Environmental Quality Act, the bill would require DEQ to establish new standards and requirements associated with chemical abortion waste. Specifically, the bill would modify 3511-302 by adding a new subparagraph requiring that the Water Quality Administrator shall prescribe first standards for the collection and disposal of discarded abortion drugs. Secondly, standards for the mitigation and remediation necessary to address the environmental effects of abortion drugs that are discharged into any disposal system, sewage system, public water supply, et cetera. And then finally, in that rule, we would establish requirements for the testing of community water systems and public water supplies to ensure that endocrine disrupting chemical byproducts of abortion drugs don't enter into a water system or a water supply. So we certainly understand the intent of the bill and concerns about risks to human health and the environment from pharmaceuticals and endocrine disrupting compounds. As has already been mentioned, there are several pharmaceuticals and endocrine disrupting compounds that can be a concern. Antibiotics, antidepressants, contraceptives, it's a big topic. There are probably thousands of pharmaceuticals and endocrine disrupting compounds that could be of concern, and there are a broad class of emerging contaminants that are on our radar. So again, I'll just emphasize the point that there are many chemicals that could be a concern from this standpoint. For the committee's consideration, I would like to cover today some potential limitations with the proposed activities as they relate to our ability to carry them out. If the state invests in these activities, we just want to make sure that there's a bang for the buck and that in addition, we don't put our public water systems out of compliance. So addressing those 3 requirements individually, first, the DEQ, the Water Quality Division, could establish standards for the collection and disposal of discarded abortion drugs. However, doing so would be a little bit unprecedented for the Water Quality Division. We don't have other regulations that speak to disposal of medical waste or prescription of drugs. So I'll just note that that rule may be a better fit for our Solid and Hazardous Waste Division, who does have regulations pertaining to medical waste, not specifically to prescription drugs, but they're more the division of the DEQ that handles disposal of materials before they enter into a water system. I do have Suzanne Ingalls, who's the administrator of the Solid and Hazardous Waste Division here today, and she is available to answer questions if you'd like to ask her any. It would help to get clarification about who the standards would apply to. Are we referring to citizens or hospitals? That would just help us understand what those standards might look like and what you're asking us to do with that rulemaking. Secondly, establishing standards for the mitigation and remediation. The first step here would be for the Water Quality Division to develop water quality criteria. And we develop water quality criteria for a broad suite of pollutants to make sure that we're protecting our waters for their designated uses, drinking water, fisheries, aquatic life, et cetera. But developing a new criteria is a big lift, particularly for a chemical like this, which has toxicological effects. We don't have toxicologists within our division. That's something that we would need to contract out in order to develop those water quality criteria. But those water quality criteria basically set the goal of what is the maximum concentration of those chemicals we can have in our water and still protect human health, fisheries, all the other uses that we protect our waters for. So in the fiscal note, we did have a $300,000 contractual cost, which is what we anticipate we would need in order to hire toxicologist, to help us develop those water quality standards. I will also note that at the federal level, the Clean Water Act, EPA does not set any criteria for these compounds. Neither are there any Safe Drinking Water Act maximum contaminant levels for these compounds. So if we develop this, we would be more stringent than the federal government with our standards. Again, once we develop those criteria, that is what would be in our rules in order to set the cleanup values if these chemicals were detected in water. Again, it's just the cleanup goal. What's the maximum level we have to protect public health and the environment? So moving on to the third part, requirements for the testing of community water systems and public water supplies. First, I will just briefly note that EPA and not the DEQ implements the Safe Drinking Water Act regulatory program in Wyoming. This is one federal primacy program that Wyoming has not taken on. So EPA implements the permits and the monitoring requirements for our public water systems to deliver drinking water to our citizens. However, the Safe Drinking Water does not limit a state's ability to have additional requirements on our public water systems. So in theory, the DEQ, the Water Quality Division, could write a rule that would require our public water systems to test for these chemicals. But just know that it would be in addition to the federal requirements that our public water systems have to meet under the Safe Drinking Water Act. Secondly, I do think it's unlikely that we would detect these abortion drug chemicals in the water sampling due to the infrequent use of the drug, the very low amounts of drugs used in a given population, the trace amounts that would end up in water, and the significant dilution that would occur. So it's just important to know that we could do sampling for these chemicals, but it may not be likely that we detect them. However, I'm not familiar with this report that Representative Bear spoke to. We would certainly like to see a copy of that and help evaluate that data and see if other communities are finding detectable amounts in water. It's also important to consider that even if you do detect the chemicals in water, it's a timing issue when the utilities collect the samples. It may be very unlikely that on a periodic basis that a utility would sample for collecting a sample in their influent or their treated water, that they would collect it right at the moment that the chemical is entering or exiting the treatment plant. So that's just another consideration about whether or not we're going to get meaningful data. Again, we would certainly like to see the report that was referenced, but based on our research, we have not found approved analytical methods for the two main chemicals that we understand are used in abortion drugs. And without approved methods, that generally means that contract labs would not be able to analyze for them. The DEQ lab does not have these capabilities, but we would need to do further research to see if our utilities all started collecting samples for these chemicals. Is there a lab in Wyoming or a nearby state that they could send these samples to for analysis with an approved method? If we do have an approved method and a contract lab can analyze for these, we do anticipate it would be fairly costly based on other pharmaceuticals and emerging contaminants. We're seeing $400, $500 per sample per compound. So just mention that if we have our utilities do the sampling, the cost could add up significantly, particularly depending on the frequency that we require them. Typically, sampling is only done on an annual, semi-annual, or quarterly basis. So again, the chances that somebody's going to pull a sample when this chemical is entering or exiting a plant may be unlikely. So, Madam Chair, I will stop there. Again, we recognize the intent of this bill. We do want to protect our public health and the environment from the risks of pharmaceuticals and endocrine disrupting compounds. But I do just want to make sure the committee is aware of some potential limitations insofar as our ability to carry out these duties. So I will stand for any questions.
Thank you. Any questions from the committee? Representative Yin.
Madam Chairman, thank you, Ms. Sigmund. So as far as you know, right now, there is no testing method for testing for these chemicals.
Ma'am.
Madam Chair, that is correct. The research that my staff have done have not found any EPA-approved analytical methods that would have an established method so that a contract lab would take samples and run these samples for those chemicals.
Thanks.
Additional questions from the committee? Representative McCann.
Madam Chair, thank you. Ma'am, this isn't the first time this type of thing has come up. The opioids, people dumping them in the toilet. Are there methods for detecting those?
Thank you, Madam Chair. There are methods for other pharmaceuticals and emerging contaminants, some endocrine disrupting compounds. I apologize, I do not have a complete list. I could get more information from our lab supervisor about what the main approved method does cover in terms of pharmaceuticals. But I don't have that information with me today. But correct, there are many other pharmaceuticals out there that would also be in the water that could be analyzed for.
Representative McCann, follow up.
I just wanted to point out that we already have that technology. It probably won't be very difficult to figure that out.
Additional questions? Okay, seeing none, thank you for joining us today.
Thank you.
Any additional government agencies that would like to come forward? Any on Zoom? Government agencies? Okay, all right. We will move on then to public comment. Again, we're on House Bill 159. If anybody in the audience would like to come forward, we're going to use the same protocol as the last couple of bills. My good vice chair will time. So, sir, if you would begin, just state your name, whether or not you support or oppose the bill, and we'll hear your testimony for 2 minutes.
Madam Chairman, Bill Winnie, Sublette County. I'm speaking for myself. I support the bill. The question before you is, at what level does a threat to drinking water and other parts of the environment, at what level does that occur? And does this in turn reflect into that? And I draw on my experience in the submarine world. We produce a lot of water in there for different things. Some of it very, very pure water. The water that goes into the reactor plant has to have zero contaminants because they can become activated and present a radiation threat later on. We, of course, produce a lot of potable water and steam generator water. The other thing is we can operate a submarine disconnected from the outside atmosphere for days to weeks to months. We monitor that atmosphere, monitor that for trace elements that can get into it. And we find some. And sometimes we go and fix things that we're putting something in the atmosphere we didn't like. And so at what level does this constituent present a threat? That's a choice to be made by the committee, but it can work its way into the environment. And subject to your questions, thank you.
Thank you, Mr. Winnie. Ma'am, if you would state your name and whether or not you support or oppose the bill, and we'll hear you for 2 minutes.
Madam Chair, members of the committee, my name is Lucy Holt. I'm the president of Students for Life at the University of Wyoming, and I am here as a representative with Students for Life Action, a 501c4. I stand before you today representing our Wyoming student groups and pro-life citizens whom I serve throughout the state of Wyoming, and I urge you to support House Bill 159. I will skip the list of reasons why chemical abortion bills are terrible for women and babies and the environment, but I would like to reiterate that once a woman takes an abortion pill, the remaining parts of the destroyed fetus will get flushed down the toilets, poisoning our drinking water and the environment, including chemically tainted blood, placenta tissue, human remains, nothing good. These endocrine disrupting chemicals are found in the environment and interfere with regulation of hormones in our bodies. Water treatment facilities are not able to remove them during the treatment processes, and then they seep into and they're recirculated into the drinking water system or discharged onto surface water, where it is then used by the farms and ranches that produce our food. When abortions occur at brick and mortar clinics, the human remains are required to be disposed of properly as medical waste. However, do-it-yourself chemical abortions at home are exempt from these requirements, making public waterways mass graves. I understand that this is just one endocrine disruptor that exists in the water supply, but this is the very least that we could do. If there's one thing that you could do to reduce the increase of these endocrine disruptors in the water for your constituents, I strongly encourage you to do so. Again, companies that profit from chemical abortions that should be responsible for cleanup, as abortion drugs and endocrine disrupting chemicals are leaching into our water supply. And abortionists should be required to provide mothers with a way to safely and humanely lay their babies to rest after an abortion. Madam Chair, I have copies of my testimony and additional information. If there's a way I can get those to you, can I give them to Mr. Caldwell over there?
Thank you, ma'am, for your testimony. Yeah, you can hand them over to Mr. Caldwell.
Amazing.
That'd be
Thank you, Chair.
fine.
Thank you, committee.
Ma'am, please state your name and who you're with and whether or not you support or oppose the bill, and we'll hear you for 2 minutes.
Thank you, Chairman. My name is Dr. Renee Hinkle, OBGYN physician in Cheyenne, 26 years. I won't even go into the abortion part of this bill because there are so many facts to refute. I have a letter from the FDA to the national group that this prior woman representative dated the 15th of January 2025 that refutes most of the assertions that this medication causes problems in our drinking water. The FDA states that the drug will not have a significant effect on the quality of the human environment. They state that the EIC from patient use of mifepristone was less than 1 part per billion, which is their lower limit of what they consider normal, and so there are no red flags for this medication based on their studies. The calculations will not have a significant effect on the quality of human environment. Remnants of mifepristone are not causing harm to the environment and to the people through environmental pathways. That metabolites from patients using mifepristone have not been causing teratogenic repercussions or congenital anomalies in animals like birth defects. They also state that the FDA is not aware of any evidence suggesting that environmental exposure at the levels estimated to be introduced into the aquatic system is teratogenic or harmful in any way. This bill does not protect women or the public. It actually addresses 2 different issues, which is not allowed in legislation. If this bill is about water safety, then it needs to include then why does it include the physical need for somebody to be in an office to take this medication? The effects of this medication take hours to affect, and so having a person in an office is unnecessary and will do nothing to change any of this. The FDA, had a large response. Catch kits. We give this medication, most of these medications, for many other reasons. We give misoprostol, which is one of the medications that they're talking about, to help stop postpartum hemorrhage in women who are bleeding out after deliveries. We give this medication for many miscarriages to help shorten the process and decrease the overall amount of bleeding that these women have from miscarriages. And we use mifepristone for Cushing's disease, so anyone that has a endocrine disorder, Cushing's disease, and we also use misoprostol for ulcers. Are these people
Dr.
going
Hinkle, you're
to,
out
are
of
these
time.
people going to also have to catch their urine and feces, which is where this is excreted and not in fetal tissue? So
Thank you for your testimony. Thank you.
I will be available after if anyone has any questions regarding the actual facts of this case. Thank you.
Did you have a handout for the committee as well, or no?
I can give a copy of the report, but it's available.
The one you
online.
referenced. You're welcome to give it to Mr. Caldwell and he can make copies for us if you'd like. Thank you. Ma'am, if you'd please state your name and who you're with, whether or not you.
My name is Wendy Volk with Cheyenne, Wyoming, living here in Cheyenne, Wyoming. I'm speaking as a private citizen. I just wanted to put some context of this bill along with the one we discussed on Wednesday, House Bill 64, because they both pertain to medication abortion prescriptions. And I want to just put yourself in any Wyoming woman's shoes, such as myself. If I found out I was pregnant and I was 7 weeks into my pregnancy, I would have 3 weeks to get a lot of things done if I wanted to seek a medication abortion. First of all, I want to make an appointment with my medical provider. She would give me an exam. She or he would give me an exam. We would discuss my options. And then if I wanted a prescription at that point, the doctor would give me the prescription, but I would have to go get a transvaginal ultrasound. Very invasive. I would go get that appointment. That provider would then give me a written report to say who ordered the transvaginal ultrasound, the age and date of that inspection or that ultrasound, and then I would take that documentation, go back to my doctor's office, and they would say, now you can go to the pharmacist. The pharmacist would review the paperwork, give me the pills. I would take my prescription, go back to the doctor's office as the bill is written, to take my very first dose in the doctor's office. Then the doctor's going to give me a fluorescent red or orange biohazard bag that I am supposed to keep at any time and have it handy when I use the restroom to maybe be able to capture whatever fetal material or uterine lining. Please keep in mind that at this point, the aborted fetal material and uterine lining at that early of a stage of a pregnancy at 6, 7, 8 weeks is not dissimilar than when I had my period. So you're asking quite a bit of a burden on a Wyoming woman. Then I'm supposed to bring the bag back to my doctor within 7 days, and my doctor's to examine me again. I don't think this is pragmatic and practical for Wyoming women and the medical providers to do that in such a short time period when we have a critical shortage of medical providers. And there's even a smaller percentage of medical providers that will provide medication abortion prescriptions. And there's a very small percentage, there's very few pharmacists in Wyoming that will be willing to even give out prescription drugs because of this. I think you're asking too much of Wyoming women and too much of their providers. Please vote no on this bill, and I would hope you would reconsider House Bill 64.
Thank you, Ms. Volk. Please state your name, who you're with, and
Yes,
whether or
I'm
not you
Christine
oppose the bill.
Lichtenfels from Lander with Chelsea's Fund. And I will try to not reiterate too much. A couple things. There is no reason to have an in-person appointment if water quality, which is in the title of the bill, is the concern. It doesn't help at all. There's also, as Dr. Hinkle referenced, based on this study, or a response by the FDA to the Students for Life of America and their petition, there's no evidence of any water quality issues. They've just responded about that. The important thing to realize is that the Cushing syndrome actually has a much greater, the people using Cushing syndrome and mifepristone to help with that, that results in over 2 times as much mifepristone in water than medical termination of early pregnancy does. There's no way to separate that out and make certain industry manufacturers liable if they're doing something completely legal and desirable, which is to provide people with the drugs for mifepristone and for the Cushing disease. And are you then going to require that they all catch all their feces and urine on an ongoing basis? That's not feasible. That's not sanitary. We should not be doing this. I think if we really want to, this has already been suggested by a couple people, but if we're really looking at water quality, the issues, there are much greater sources right now that would be more important to regulate, such as fracking chemicals. They've been known to be important in endocrine disruptors. So we might, in Wyoming, spend more time focusing on that if our goal is to limit endocrine disruptors. And at this point, I think it's quite clear that Wyomingites do not want the state to spend still more money on litigation defending a law that limits their freedom to make private healthcare decisions, a law that's unconstitutional, it's not feasible, and it is in fact cruel in what it's requiring. So I ask you to vote no on this.
Thank you for your testimony. Please state your name, who you're with, and
My name is Linda Burt, and I'm with Wyoming Right to Choose. Good morning, Madam Chairman and committee. I'm going to be very brief because I think we've heard a lot of information about this bill that says it's unrealistic, it's costly, it's unnecessary, and it also may not bring any information, given the testimony from DEQ, which I thought was excellent testimony. The cost of this bill, obviously, we've seen that there's going to be additional charges in terms of what kinds of things DEQ can do in contracting and in hiring other individuals to put this process together. One thing I did want to mention, there have been 36 deaths. Those 36 deaths have happened since the year 2000. So it's those 36 deaths, and that's from the FDA most recent numbers, which are 12/31/24. Those are millions of people that have used these drugs in different situations. The FDA also stated that there may have been other issues involved with these women that caused these deaths. They may not have necessarily been totally a response to the drug. So that's 36 since the year, let's see, that's 25 years, 36 deaths in 25 years. The other thing I did want to mention, because there was a question about this, is in terms of the lawsuits, there was a question regarding international kinds of lawsuits. These are very difficult and very onerous kinds of process. You must have jurisdiction in your jurisdiction. That would mean the state of Wyoming would have to have jurisdiction over a manufacturer in China. There are different ways to prove that or show that, but they are a legal process that requires intensive kind of work. The other thing that you would have to have, of course, and I think this was mentioned, is you would have to have a relationship with this country like China. And you would have to have an international agreement with The Hague, and that would be another complication of the legal situation. So many of these drugs would not only cost different kinds of cost in terms of the DEQ, but the litigation would be long-term, it would be onerous, and it would probably require the hiring of people who were experts in those fields, in those legal
you
skills.
were out of time. I
Thank you.
apologize. Thanks for your testimony. Ma'am, go ahead and state your name, and we'll hear your testimony for 2 minutes.
Candace Machado, the mayor of Evansville and a social worker for 2 decades. So I have a lot of constituents in my area asking me, why are our legislators and representatives wasting our taxpayer money on bills that are inappropriate, inhumane, and frankly, absolutely ridiculous? And I'm in an agreement with them as
Mayor, I'm just going to ask you to focus on the bill. Please don't
as
insult
a
the body.
social worker,
Thank you.
as a social worker, and as a taxpayer, I find it extremely inappropriate that we are spending taxpayer money for the state of Wyoming on these bills when they are infringing and imposing on human rights and targeting women in this state. And as a mayor of a town, I have to go back to my constituents and explain to them why we're wasting taxpayer money. So I could get into the discussion about abortion, and I could get into the discussion about being a social worker and seeing the mental health repercussions that our decisions and choices are being made on a legislative platform. I'm not going to get into that, but what I am going to say, for us small towns, I have 3 people that are working in my water treatment plant in my town. And we're already up to our eyes in lots of different issues that we have to address and deal with at this moment in time. And so I need to understand that how are we going to be addressing this bill with small towns when we don't even have the staff or the employees to address the said issues that are happening? I'm absolutely against this as a woman, as a mayor, and as a social worker in the state of Wyoming. And it's absolutely ridiculous to think that taxpayers should be wasting money on these types of bills. Thank you, Madam
Mayor,
Chairman.
for your testimony. Sir, please go ahead and state your name, who you're with, whether or not you support or oppose the bill, and we'll hear you for 2 minutes. And please stay focused on the bill, everybody.
Okay, I'm going
Thank
to
you.
be focused on the bill. My name is Greg Hunter from Laramie, Wyoming, and I do a ton of environmental consulting. So I just want to point out a couple of issues. I am for this bill because what I think it does is we are now starting on our way to regulate all kinds of drugs that will impact our water supply. And I want to point out that under the Clean Water Act, there's 2 different acts that we would have to change here. While the DEQ person said that we don't have any primacy under the Safe Drinking Water Act, that's not quite correct. We do have primacy under the Safe Drinking Water Act for discharging through septic systems. So if we have subsurface septic systems discharging into our waters, that is really the primary concern where these drugs are going to impact our drinking water supply. Under the Clean Water Act, we simply discharge them out the wastewater treatment plant. It goes into our rivers, and Nebraska drinks our water. So we really don't, it's not that big a deal. What we really need to concern ourselves, and what this bill will do, is we'll force DEQ to start sampling these septic tanks, and we'll force our communities to start looking at these septic tanks and making sure that the water that infiltrates from all these septic tanks that are coming in that impact our drinking water, which we are the only state in the union that doesn't have primacy for our drinking water. We make Denver EPA come out and do our drinking water. So again, those 2 things, which are going to, force a lot of money the legislature is going to have to spend to make sure that our drinking water is going to be safe and clean. And then these people that are providing these drugs accurately are just going to collect the urine and discharge it as a hazardous waste. So I really want you to pass this, because I think in the future, we will be able to regulate all kinds of drugs and make our drinking water safer in the future. So I do think this is a forward-looking bill.
Thank you for your testimony. Please state your name and who you're with, and we'll hear you for 2 minutes.
Thank you, Madam Chairwoman. My name is Sarah Burlingame. Thank you, committee. I'm with Wyoming Equality. We are in opposition to this bill. And I just want to say briefly that we understand that you ran on pro-life positions, many of you, and that you represent that viewpoint, and you're representing your constituency. We absolutely respect that. And that is an issue that we can fight our own corners on, whether it comes to legalizing or making abortion illegal. What Wyoming Equality would say about this bill, though, is that it attempts to do something that is not quite sincere and is sort of a backdoor way of saying, we would like to make abortion illegal. And we would say, if that's your goal, say and do that. And I'm going to repeat my now good friend Ronald Reagan and say the 9 most terrifying words in the English language. I'm here from the government, and I'm here to help you. We've heard 2 things that we believe that this bill believes that it can now legislate for Wyoming people. This and the bill before it. Transvaginal ultrasounds. It is a gruesome thing to say, but if you're not familiar with it, that means that the state is now empowering a doctor to penetrate a woman's body in order to get information for the state. And if you think it's a gruesome thing to say, it is so much more gruesome to actually experience. And I would say that the people of Wyoming would stand in opposition to that kind of government overreach. We've also heard that in an effort to make some medical abortions illegal or monitored or policed by the state, we are now opening up everybody's homes to the state. We've heard testimony from DEQ saying we don't distinguish between some medical waste and others. We don't distinguish between menstrual blood and miscarriage blood. The idea that the folks who have brought you here to represent them want you to grow government to the size that it can fit in our toilet, I think is one that is not supported by the facts. So I would ask you to carry your sincere belief that abortion is wrong and the state shouldn't do it, and we'll have that argument with one another.
Thank
But
you.
bills like this are insincere, and I'd ask that you resist them. Thank you, Madam Chairwoman.
Thank you. Thanks
And I would
joining
stand for
us.
any questions.
Okay. We're just taking comment, so thank you. We want to hear from everybody. Thank you. Sir,
Good
please
morning.
state your name and
Good morning,
we'll
Madam
hear your
Chair
testimony.
and committee members. I'd like to reiterate what the young lady from Students for Life said, what Captain Winnie from the U.S. Navy, I was in the Navy also, what he had said about contamination, and I'd really like to reiterate and say everything that Greg Hunter, who was just up here, he and I had many discussions on many topics. We don't always see eye to eye, but he was spot on. I mean, I had to agree with everything he says. So not to go over all those points, to be succinct, I think Greg Hunter had superb points. This is a good step forward for drinking water, et cetera, and our water supply period. So dittos on what he had said. I appreciate it. Thank you.
Thank you. Okay, we will move, it looks like there's just a couple online. Okay, I don't know that we'll get to 8. Yeah, we'll take a couple though and move on. Welcome, Ms. Laurent. Please state your name and who you're with, whether or not you support or oppose the bill, and we'll listen to you for 2 minutes.
Good morning. Madam Chairman, before I begin, you did not invite lobbyists to testify in HB 42. Is it appropriate that I testify now, or would you like members of the public to testify first?
Thank you. So that bill has been passed. You're welcome to use your 2 minutes, but I'd hope that you'd focus on the bill that's in front of us. And
I plan to. I was hoping to understand the precedent for this committee going forward.
Yeah, we'll hear registered lobbyists after public comment. So, but please proceed.
All right. Well, dear Madam Chairman and honorable members of the committee, my name is Emma Laurent. I'm with Wyoming United for Freedom, and I am testifying from Sheridan in opposition to HB 159. 1 year ago, my doctor prescribed me misoprostol, a drug which has many uses, one of which is to terminate pregnancy. I was prescribed misoprostol to ripen my cervix, making it easier for my medical professional to insert an IUD the next day. For the next 6 hours, my urine and resulting diarrhea contained traces of the drug. HB 159 is not concerned about traces of abortion medication in the water. If it were, we would be creating a special counsel to determine techniques to best capture one's own feces in a jar while on the go. HB 159 is concerned with shaming and discouraging women from seeking medication abortions. Asking a woman to collect what is often a small amount of blood and cells, in addition to other bodily fluids that are often expressed during a standard menstrual cycle, such as uterine lining, urine, and diarrhea, is demeaning to say the least. However, asking her then to place this waste in a bright orange or red biohazard bag and deliver it to a medical facility goes one step further by not just publicly humiliating women, but also violates their HIPAA protections. This copycat bill is meant to create conspiracy fodder about our state's water and scare women into thinking their private health decisions are now traceable and therefore open to retribution. Instead of worrying about if our water is safe from meth or fracking chemicals, the sponsors of this bill intend to tell women, we are watching you. Thank you.
Thank you for your testimony. Thanks for joining us.
Hi, can you hear me?
Yes, welcome. Please state your name and we'll hear your testimony for 2 minutes.
Hi, I'm Winter Black. I live in Wyoming and I'm here as a private citizen. More people who are more qualified than me have already spoken about how this is degrading for women and the actual facts about water contamination. So I would like to bring up the point that abortion medication is one of the most relied on forms of abortion and reproductive health care. And that I have already seen affected people who would be affected by this bill sharing tips on if their reproductive health care access is restricted, different dangerous plants they could consume that would abort a pregnancy or other more dangerous methods. And bills like this are not going to stop people from ending their pregnancies. It's only going to make it far more dangerous for people to do so. That is my only point, and I appreciate you hearing me, and I implore you to vote no on this bill.
Thank you for your testimony. Okay, we'll take one more from online and then, okay.
Hello,
Welcome, Mr. Brechtel.
Bob Recto, Natrona County citizen, former legislator. I rise in support of House Bill 159. I just want to point out that our community did not vote for abortion business for profit in our community. In fact, we voted against, but that aside, we now have hundreds of people coming from all surrounding states. We become an abortion destination into the center of our Wyoming community. And we believe that this issue should be addressed. Thank you, Madam Chairman.
Thank you, Mr. Brechtel. Okay, are there any registered lobbyists in the audience that would like to testify? Okay, seeing none. I will close public comment. Committee, what is your pleasure on House Bill 159? Bill's been moved by Representative McCann, seconded by Representative Gugamas. Discussion on House Bill 159 or amendments. Representative Ian.
Madam Chairman, members of the committee, this bill is very different from the other bills. I think I would say it strains my ability to take it seriously, frankly, but I'd have to because it is legislative business and it is before us and we're actually contemplating passing it. It's clearly model legislation. I think that's, when you see notwithstanding sprinkled around everywhere, and half of the bill is all about severability, so it's basically legalese saying, just in case parts of this is found unconstitutional, keep the other parts. Those come from definitely out-of-state groups who already know that it's being constitutionally challenged in other places. But frankly, I think the biggest problem with the bill is that it's what Ms. Burlingame said, that it's not really honest about what it's trying to achieve. I think it's clear. The intent is not necessarily clean drinking water. The intent is to ban abortion, which we already passed a bill in the state to do. They're just doing it in a way that is frankly shaming people into not wanting to go in at all, right? Like it is telling them that they have to capture their miscarriage in a bag is probably one of the most shameful things I've seen the government ask people to do. We're not talking about capturing their urine. We're not talking about capturing their feces. We're not talking about capturing any other drug. We're not talking about capturing any other endocrine disruptor. It only targets abortion. So if you just want to ban abortion, let's do that. If you want clean drinking water, then have an honest bill that talks about how we clean our drinking water. Again, we've heard that these drugs are both used for different purposes other than abortions. We've heard that there isn't a test for these drugs. If we're actually taking this bill seriously, when we move to the floor, I'm going to talk about how we keep our water clean. Because if that is truly your intent, members, I'll work towards getting our water cleaner. I'll bring amendments to help keep our water cleaner. But I don't think that's what you want with this bill. So with that, I'm going to vote no. Thank you, members.
Further discussion from the committee. Representative Klaustin.
Thank you, Madam Chair. This is probably the first, let's be honest here, pro-life bill that I'm really hesitant on. These medications are used for so many other things. I don't know how we're going to actually determine where some of these drugs are coming from. And again, I don't see us being able to really enforce suits on foreign governments and know where all this medication's coming from. So just from the testimony, I think right now this bill's a little bit unreasonable and maybe a little bit ahead of its time. I think I'm a no at this time, and if there's something we want to really, this is a 25-page bill. This is a big deal. If this is something we want to look at in the interim topic, I would be in favor of that. I just don't think this bill right now is ready for what we need. Thank you.
Thank you, Representative Klaustin. Further discussion, Representative Wasserberger.
Okay, well, just so we can maybe give everybody a win on this, I was thinking I was looking here on page 6, line 17, for the part where we have a violation on punishable charges. I was thinking I'd be willing to propose an amendment that we change the imprisonment time from 3 years to 1, and be willing to also lower the fine from 10,000 to 7,500, and just to be able to listen to all sides. If anybody-
Representative Wasserberger, would you like to move that amendment?
Madam Chair, I'd like to move that amendment. If there's a second. No one's going to second? Okay.
Okay, for lack of a second, the amendment has failed. Any further amendments?
No, thank you. I'm done, Madam Chair. Thank you.
Committee? Any further discussion or amendments on the bill? Okay. All right. Seeing none. Mr. Caldwell, if you'd call the roll on House Bill 159.
This is a roll call vote for House Bill 159. Representative Klaustin?
No.
Representative Guggenmoss?
Yes. Aye.
Representative Heft? Representative McCann? Representative Ottman?
Aye.
Representative Stivar?
Excused.
Representative Wasserberger? Aye. Representative Yen?
No.
Chairman Rodriguez Williams?
Aye.
Madam Chairman, that is 6 aye, 2 no, and 1 excused.
Okay, House Bill 159 has passed the committee. Representative Bear, you'll carry that on to the floor. Okay, committee, we have one more bill on the agenda, which is lost in my pile here. We are going to carry that bill over until next meeting. It's 10 till, that bill was House Bill 164 titled Medical Prescriptions Off-Label Purposes. My apologies, Representative Johnson, I hope that we could got to that. I mean, Representative Brown, I wish we could have got to your bill. But we'll hear that Monday morning. It'll be the first bill on the agenda, so my apologies to you. Okay. Thank you. All right, committee, we are adjourned.